Hello, I'm Dr. Roger Anderson, and today I want to talk about flapless dental implant placement. Dental implants are used to replace missing or failing teeth, and today we have Dr. Hirsch with us. Dr. Hirsch is a family practice physician, and he's actually had both procedures done. He's had a dental implant placed with a flapless technique, and he's also had an implant placed where the bone was exposed using a flap technique. So I'd just like to talk about the two different techniques a little bit. Was there any discomfort following the procedure?
Not really. I took 3 ibuprofen as soon as I left the office, and within 2 or 3 hours the anesthesia had worn off and I didn't feel any discomfort at all, and I did not take any more ibuprofen throughout the day.
And how would you compare this procedure to having a flap with the bone exposed?
Well, it's remarkably different. With the flap procedure, the entire procedure took probably an hour or so. Obviously the flap had to be repaired with non-absorbable sutures, and I was generally uncomfortable for a couple days thereafter. It was not intolerable, but it was some level of discomfort. With this procedure, there's no flap. From the time the anesthesia had become effective, the procedure itself only took 10 minutes, and as I mentioned previously, there was minimal to no discomfort. Within 2 or 3 hours, I was ready to get on with my normal activities.
And would you compare it to the technique with the hip replacement?
Yeah, interestingly in medicine there's a new approach to hip replacement. Traditionally, hips were approached through posterior or lateral approaches where the muscle had to be cut. Patients generally spent 2 to 3 days in the hospital and then went to rehabilitation for a prolonged period of rehabilitation lasting 7 to 10 days, and very often patients were unable to return to normal activities for 2 to 3 months. There's now a new approach to hip surgery whereby the hip is replaced using an anterior approach where no muscles are cut. I've heard of patients who leave the hospital the evening after the procedure, and most patients leave the hospital within 24 hours, and most patients are back to normal activities and gainful employment within 7 to 10 days.
Okay. And would you recommend anyone else to have this procedure done?
Oh, absolutely. I really strongly believe that this is the way to have a dental implant, unless there's a contraindication of this approach. If there are significant bony or dental issues that require a flap approach, well, that's what need be. However, if this is an option, then I would strongly encourage people to consider it.
Very good. Thank you.
You're welcome.
Appreciate it.